as promised, the Health Minister is with us now. Helen Whately, hi, good morning.
Good morning.
Thanks very much indeed for joining us on the programme this morning. Let's start, first of all, with the NHS workforce plan, if you wouldn't mind. I know there's lots to talk about. We are short of 12,000 hospital doctors, more than 50,000 nurses and midwives. So said Jeremy Hunt when he was chairman of the Health Select Committee. 13 years of Conservative government.
So two things are happening. First, I'll talk about what we've been doing over the last couple of years at the moment, and then come to the long-term workforce plan, which we're going to be publishing later this week. So since 2010, we've increased the number of doctors in the NHS by over 40,000, nurses in the NHS by over 50,000. We do have record numbers of staff in the NHS. In fact, in the last election, the government made a commitment in our manifesto that we would recruit and retain over 50,000 more nurses in the NHS, and we're on track to do that. But we know that we need to go further. We know also that a significant proportion of our staff are internationally trained doctors, nurses and other healthcare professionals. They're doing a really good job. And I should say it's really important to say we hugely value the international workforce as well as our UK workforce, but we want to be able to recruit and retain more UK-trained doctors and nurses, and that's going to be part of our long-term workforce plan. This is a historic first for the National Health Service, actually, to have a long-term, future-looking workforce plan. That's going to be published later this week.
Pay them more.
Well, we have just been going through a number of pay negotiations with National Health Service staff and reached agreement with over 1 million of those staff, which includes, for instance, middle nurses on band 5 nurses. That's usually a nurse working in the ward getting a pay rise around £5,000. We draw on the recommendations in our pay process, of course, of the pay review
So you
bodies.
are going to accept the recommendations of the pay review board?
Well, actually, I've already been asked about this question this morning, and what something that government does is always looks at what we receive from the pay review bodies. I've been involved in that process myself in the past as a health minister with oversight of workforce, and hugely value the work of the pay review bodies. I'm actually not going to preempt the next stage in the process.
But they've said 6 to 6.5%.
So I'm not going to preempt the next stage in the process. So what happens is the pay review bodies provide their recommendations to government. Government reviews that and then responds with a pay proposal. Obviously, government has to look overall at what is affordable. And the Prime Minister has been very clear, in fact, talked about this over the weekend, about our need to be responsible with the public finances. Our number one priority, of course, is we must bring down inflation. So government has to look at things in the round. So I'm not going to preempt the response that we'll make to the pay review bodies.
But just to clarify, the pay review bodies take direction from government budgets, don't they?
So
you tell them how much money there's available.
So the government provides input into the pay review bodies.
And the Prime Minister chooses the chairman of the pay review boards.
So they have it is an independent process. And I said, I actually, as a minister,
does the Prime Minister choose the chairman of the pay review boards?
So I don't know the exact process of the appointment of the chairman.
So the chairman chooses, the PM chooses the chairman of the pay review boards, and then the government tells the pay review boards what the upper limits are of the budgets, and then they say, OK, as a result, 6% for nurses and doctors and 6.5% for teachers, or whatever it might be. So you say, OK.
So the way the process works is the pay review bodies gather evidence. They take inputs from government. They also take evidence from the workforce unions, from the health unions. They also look at the kind of rates of pay in the wider market. They look at inflation. So they look in the round. And they come back with a recommendation. Yeah. Well, actually, there's a number of pay review bodies, different parts of the public sector. Some have reported back, others haven't. Government has to look at public sector pay and pay in the round. And it makes sense for us to do that because we have to make responsible decisions as government.
I mean, nobody...
Well, I didn't for a moment say that. I mean, let's be clear. We take the advice and recommendations from the pay review bodies, but you all understand that government has to be responsible with the public finances. That's why I can't say here and now what the outcome of the whole process is going to be. We know we have a number one priority of bringing down inflation, and actually the job in government and job of Prime Minister is to make tough decisions.
So can junior doctors, just to clarify, can junior doctors, can police service, can teachers expect between 6 and 6.5% has been recommended by the public sector pay review bodies?
So I'm not going to preempt the outcome of the government's response to the pay review bodies.
But when your colleagues, and indeed you have sat there previously, and we've talked about percentage pay increases, you've always said we have to abide by what the independent pay review bodies suggest to us.
I don't believe that is what we've always said. What we always say, usually say, and certainly what I've said in the past, I believe, on this, is that we look at the recommendations from the pay review bodies. It's very important that they
Even
provide us with that
chairman
evidence.
is chosen by the Prime Minister and you tell them what the budgets are.
So what's
the point?
So the point is to have a process where you have expert advice on recommendations on pay, but the government has to make decisions in the round. But what we're also doing, as I said, is coming forward later this week with a long-term workforce plan, because on the one hand, here and now, we are supporting the NHS workforce.
Talk to me about the lung cancer investments.
Sorry?
The lung cancer investments.
I'm delighted to talk to you about the announcement we're making today, which is a rolling out of a national lung cancer screening programme. So that is going to be inviting people who are at higher risk of lung cancer. For instance, that's people who have been smoking, aged between 55 and 74, to come forwards to be assessed and then invited to lung cancer screening tests. The reason we're doing that is because, very sadly, lung cancer is one of the country's biggest killers. It kills over 35,000 people a year.
Wow.
And that is partly because too often lung cancer is diagnosed late. The majority of people are diagnosed late with lung cancer, and if you're diagnosed late, treatment is less likely to be effective. In fact, unfortunately, if you're diagnosed late with lung cancer, your prospects of surviving 5 years are only around 4%. If you're diagnosed early, it's more like 60% prospect of surviving lung cancer. And we know that with this kind of targeted screening programme, we can then diagnose the majority of lung cancers early, and that makes a big difference to people's outcomes.
One of the other big concerns, of course, is breast cancer. We've seen the Duchess of York is recovering, thankfully. We believe she's had a mastectomy. She's talking openly about it. A lady that came to talk to us, Susan Michaelis, she has lobular breast cancer, which is perhaps a breast cancer that is not as well known as the more normal kinds, if you will. And she came to see you after she'd been on our programme. You very kindly agreed to see her. And you said that you would bring up lobular breast cancer with the Institute of Cancer Research. Have you done that?
Well, I've had several meetings with cancer charities and cancer organisations, and that's one of many things that we talk about. I'll have to get back to you about the specific details of all the conversations I've had with breast cancer charities. One of the things that I've been talking to breast cancer charities is about our screening programmes. We know that screening is really, really important. In fact, as the Duchess of York has been talking about, and I wish her very well from her recovery from her treatment. And she's emphasised rightly the importance of people taking up their invitation to go for screening. And we continue to look at what things we can do to make sure that we diagnose cancer as early as possible so people have the best possible outcomes.
Yeah, we wish her well, most certainly. All of us watching this morning as well, I'm sure. Final thought, the Prime Minister yesterday telling people that they should hold their nerve over their mortgage payments going up. You're looking forward to saying that on the doorstep when you're campaigning for the next election?
I think it's been slightly misquoted on that, but I think overall his point is that we as a country, we know that it's going to take time for us to bring inflation down. It's his number one priority. Clearly, it's one of the 5 priorities that he set out, was to halve
so we just need to
inflation,
hold our nerve, is that what
along
we're
with
saying?
growing the economy, reducing our debt, cutting our waiting lists and stopping the boats. You'll have heard that those are 5 priorities that we have to do. But inflation is not going to come down overnight. This is hard work that we have to do as a country. It includes the government making responsible, tough decisions on the nation's finances.
OK, for now. Thanks very much indeed. Thank you.